Well, it means very important things for North Dakotans and, of course, the nation as well. Perhaps most important, it has significant deficit reduction. Over the next 2 decades, according to the Congressional Budget Office, this act will reduce the deficits by $1.2 trillion. That is a very important beginning at getting our long-term fiscal house in order. Well, one of the most important things for North Dakota, of course, is more fair Medicare reimbursement for our doctors who treat Medicare patients and for our hospitals. As you know, we have been at or near the bottom in terms of reimbursement for decades. That's worked a hardship on North Dakota, one that is becoming increasingly difficult to deal with. This legislation contains the Frontier Amendment that gives relief to 5 states, the most rural states in the nation, that have been treated unfairly for a very long period of time. It will mean an additional $650 million to North Dakota hospitals and doctors over the next decade, and that is going to make a meaningful difference in their ability to maintain and improve quality and excellence for our patients. Well, I'm very proud that my cooperative proposal has now been adopted and has become the law of the land. That will provide $6 billion to allow cooperatives across the country to offer not-for-profit insurance to consumers all across the United States. And we know from what has worked elsewhere that these not-for-profit cooperatives can make a real contribution to quality care and to holding down costs. Well, the comprehensive bill is complete, signed by the President into law today. The final process is a package of amendments to improve the legislation, to make it more affordable for middle-class consumers and to improve the reimbursement to states for their Medicaid patients, and of course to close the donut hole for our seniors, as well as to take out, for example, the Nebraska provision that was so controversial. So that's the legislation that's before the Senate now. It's already passed the House. And of course, again, I think the important thing to remember is the main bill, the comprehensive health care reform, is now the law of the land.